Sally Callow. Hello, hello, hello.
Hello, I'm just looking to see if I can change my background.
Oh, I can see your bookcase and I can see Foggy.
It's not really Foggy, that's a book with his picture on the front, but I thought, well, as he's not here, that's the closest I can get to it. So
He's on holiday. Where's he at?
Maryland in America. But she runs Emmy Action in Maryland, so anyway, she's had him for about 5 days. I haven't had any photos yet. I hope he's okay. But anyway, I digress.
And how are you today?
I didn't sleep very well. Millie's on my mind.
I didn't sleep very well either. I totally understand. I don't know if that's, well, I do know it's a lot to do with the sleep disturbance that's related to Emmy. But yeah, there's a lot on our minds, isn't there? With everything that's going on.
Like many teenagers, Millie McCain enjoyed miming on TikTok and taking selfies on her phone. That was before she was hospitalised, needing to be fed through a tube. Diagnosed privately with severe ME, she's now spent 10 weeks in hospital.
We just want her to be okay.
Her family say her condition is worsening. The chronic fatigue is so bad, they say, she can't move properly and struggles to talk and eat.
It's been so distressing for us to see her in so much pain and to see like my young 18-year-old sister who is so full of life, so much fun to talk to, an amazing person. We'd never stop laughing when we were together. Like, we'd laugh for ages. You can vouch for this, you'd hear us. Yeah. And then to see her just lying in the bed, unable to move much, unable to talk much, and just in so much pain is so distressing for us.
Millie's family fear medics aren't taking her symptoms seriously, and they say the hospital environment is actually making matters worse. Her family joined a protest today to ask the hospital to listen to their pleas before Millie gets any worse.
So why don't we start by you telling us a bit about yourself, who you are and what you do?
So I'm Sally Callow. I've had ME/CFS twice in my life. The first time was undiagnosed in my teenage years, 13 to 15. Lots of tests, no idea what was wrong, and I just got better. Didn't think any more of it. And then when I turned 30, I was studying for a master's degree, doing 2 jobs, and I got an ear infection, and it triggered ill health in me. It took me 2.5 years to get a diagnosis, and I was diagnosed with chronic fatigue syndrome. And at the point that I was diagnosed, the locum doctor, who I'd never seen before in my life, said, I think you've got chronic fatigue syndrome. Think yourself lucky you don't have ME, because that's so much worse. So he literally said to me, go off, increase your activity. This was 2008, which was around the time of the PACE trial, which you all know about, Jenny. So I was just told to take my dog for more walks to get better, and I was told that I'd get some talking therapies, and it was downplayed so much, I thought, that my illness was insignificant. And then so I kind of plodded on with life for 7 years. And then I had an idea to do a fundraiser, and I thought, well, if my chronic fatigue syndrome is this bad and people with ME have it so much worse, I'm going to fundraise for people with ME. At that time, I did not think that I had ME. And that's when I launched ME Foggy Dog as a fundraiser. And since then, I've since been diagnosed with ME, and I know what the criteria are. And I'm livid that I was not asked any questions related to the diagnostic criteria for ME, but he was very confident that I didn't have ME. Anyway, so that took me up to 2014, and then I started getting involved with the advocacy, awareness raising and fundraising.
The PACE trial is, in short, bad science, and I hope will one day be revealed as the biggest medical scandal of the 21st century. Thankfully, in 2021, the NICE guidelines changed. But now we face NHS hospitals not adhering to the new NICE guidelines.
I remember campaigning for those NICE guidelines when they were paused, give them to us now. But we don't seem to have made any progress whatsoever.
Well, no, because even though they've changed and we're not on paper as an ME patient being treated with cognitive behavioural therapy and graded exercise, now that they've finally listened to the science to date, we have stories of severe ME patients and mild to moderate ME patients still saying that they are being offered this. And that's really why you and I are talking, because you've got a petition on the go that I very much want as many people as possible to sign. So can you talk a little bit about that petition in particular?
So anyone that doesn't know, ME is a spectrum disease. I'm on the mild end. And the people on the severe, very severe end are house or bedbound. Very severe is bedbound for a really long time. And over the years, in the 10 years of my advocacy, I've seen too many people die as a direct result of the care they've received in NHS hospitals in England and the rest of the UK. And then there seem to be, I don't know if it's because our community is getting bigger, but there seem to be more and more and more cases of usually young women, with severe malnutrition in NHS hospitals, dying needlessly. So I started to think about, hang on, if the NICE guidelines are here and the NICE guidelines say don't do this to a degree, they're not perfect, but they're a massive improvement on what we had before. Why is this still happening? And then I started to talk to my friends in the NHS, Department of Health and Social Care, and they're like, well, nobody really follows the NICE guideline. There was an article the other day that says something like 76% only adhere maybe once a month. And I started to think, okay, well, what else do the NHS use in terms of caring for people? They have protocols and policies. If you look on any hospital or ICB website, it will have something that says protocols or policies. And it's everything and anything from how to take a blood test, how to treat someone with a cardiac arrest. There's nothing anywhere in the NHS in England, Wales, Scotland, or Northern Ireland to tell somebody in a hospital how to look after someone that presents with ME, whether that's mild ME or severe ME. So I wrote a letter asking for the creation from scratch of an NHS protocol in England and Wales and Scotland. And I've written down what that includes. There's four factors. So 1, specialised care pathways. They currently do not exist. Education and training. Stripey light bulb exists, but there are an awful lot of medics that won't do training offered by VCSE. They need to be taught in a university, accredited by the NHS, etc., etc. Research and innovation, that includes severe patients. Severe patients are so poorly, they can very, very rarely take part in any kind of research study. If they don't live near London, they tend to not be included in QME work because of the difficulties in transferring data around the country, especially if it's time critical. And then patient involvement in things like research plans and stuff like that. Very often severe are excluded from that, again, because they can't attend meetings, they can't fill in forms. So all of this is to include severe ME patients in healthcare in the UK at all levels. So yeah, we desperately need this NHS protocol because there are currently 4 very severe patients at risk of severe deterioration slash death in England at the moment, and it's desperately needed.
If you wouldn't mind, if you can tell me a little bit about your charity and your CIC, isn't it? It's not a charity.
So Stripey Light Bulb offers training for healthcare, employers, and teachers, education professionals, because in those 3 areas, all of my advocacy has told me, and all the thousands of conversations I've had with patients have told me they are the areas that we additionally struggle in. Lack of reasonable adjustments, or why can't you work in the office 5 days a week?
Yeah.
Why do you have to work at home? Why can you only work part-time? And then when you go into a healthcare setting, it's an absolute nightmare, but we'll go into that later. It covers everything from the ME history, stigma, the economic burden, because when you talk to governments about things that need to change, they like to know the economic cost. So I just say, well, at the moment, we cost you this because you've abandoned us. This is our burden on you.
So something else that caught my interest is the hashtag MP Do Your Job For Me. Can you tell us a bit more about that?
Yeah, sure. So this is last year we ran this. There was an in-person protest, online protest, and I worked with the Chronic Collaboration on creating a document that could be sent to MPs around the country, because it came to our attention that what was happening was when very severe patients were in hospital, they would contact their MPs for assistance, because that's what they're there for in theory, and the MPs were saying, you need to go back to your GP. So not, okay, I'll intervene and see if I can get you better care in hospital. I mean, these people are deteriorating, on the verge of death for weeks, told to go back to their GP for help. So with the Chronic Collaboration, and I wrote this document, and it literally tells MPs what the problem is with telling them to go back to the GP. They need to know a little bit about ME, because a heck of a lot of them haven't got a clue. What the NICE guidelines say about severe ME, and also some research to reinforce what we were saying in terms of feeding tubes and the position that people need to be laid in. And we encouraged people with ME to send it to their own, because obviously you can only speak to an MP if you are their constituent. So we couldn't just bombard MPs with it, it'd be chucked in the bin. So we asked people with ME to send it to their MP, whether they are currently severe, very severe or not, because desperately sad as it is, when you are very severe in hospital, you do not have the capacity to contact your MP, and your family may not even know that MP Do Your Job For Me exists. So we were asking everybody to send it to their MP so that the MPs had the information, you know, to hand. They could just file it away. Oh, I've got someone with ME. What does it say in here about that? So severe ME and very severe patients need better advocacy from their politicians. And that is not nation specific. So it can be sent to any politician anywhere around the UK. And it has to be UK because it talks about NICE guidelines. But yeah, I'm proud of it. It's a really good document, and it's a very good starting point for advocacy when someone is severely sick in hospital. Anything you need to know can be found on both ME Foggy Dog and Stripy Lightbulb CIC's websites. As you can see on the screen, this is mefoggydog.org. This is the homepage. If you scroll down where it says Foggy's campaigning, hashtag MP Do Your Job For Me. If you click on this tab here, it takes you through to Stripy Lightbulb's website. Because to be perfectly honest, I've got ME myself. I didn't want to put exactly the same content on two different websites. So you just click from one to the other. So whether you go to Stripy or ME Foggy Dog, you can find the same information.
It's hard to imagine how something as simple as light coming through a window could cause so much distress.
No, this light, it was covered, they took it. This one, there was cover here.
But many people with severe ME or CFS experience extreme sensitivity to light, sound and smells, to the point that it can make them ill. Carla's been treated at West Middlesex Hospital after being initially admitted with problems with her nasogastric feeding tube, but her family believe she deteriorated last week when the covering for the window was taken off.
They gave them warning, if you do take the lights and you let her to see the lights, and then she cannot tolerate it, maybe she will die. The doctor he said to me, no, she will not die, don't worry. And look what happens for her. Now she have a seizure.
Pierre and his wife Caroline have been taking it in turns to stand in front of the window to try to block the light. But what they really want is for Carla to be treated by an ME/CFS specialist and to see a neurologist. They've said that her symptoms, they think, are psychosomatic.
No, the symptoms, based on the medical evidence and NICE guidelines, it is 100% physical and not psychological or mental.
The feeling seems to be that it's hard to treat an illness that's so poorly understood, but what it can do is obvious. This is Carla before she became so unwell.
You can imagine how hard it's for a mother to watch her daughter suffering from all this, going through all this, and being unable to do anything, and her condition is becoming worse and deteriorating day by day.
It's like trying to fight a monster that you can't see while trying to convince everyone around you that the monster is real. Carla has her mum and dad fighting with her.
How about we also utilise this opportunity to reach out directly to the list of ME charities? I have several of them on my Bake4 website. But we could use this as an opportunity to reach out to them and actually plead a little bit and say, look, these are two really important things. I don't know how much tweeting or quote tweeting goes on, but can we bring you on board and get this out there to as many people as possible? So maybe I'll show the list, and hopefully with their help, it can just lead to more exposure.
I'm open to that. I'm going to do my absolute utmost to make sure that we get this NHS protocol. So I just need a few people to believe in me and the power of my advocacy to try and get this over the line, really.
Absolutely. And the power in numbers and the power of coming together and the power of uniting. This is the time more than ever that the letter needs to be signed, the petition, and also people need to be aware of how you can contact your MP about this.
I've mentioned this in every interview that I've ever had, and nobody ever includes it.
No, and we've always wanted it included.
It will be included. If a hospital is inflicting pain on purpose, why would we not include it in the interview when I'm trying to raise awareness about the abuse and the neglect that is happening?
Yeah.
So please,
For me,
talk more on that.
For me, the most obvious example of that is when she went in to have the pedge fitted.
So they started the procedure, and Miriam was saying from the minute they started, I could feel it. I need more sedation. And they wouldn't listen to her. They just kept saying, no, you can't. No, you can't. And they carried on. I just cried, saying, I can feel it. And I was saying, please, you've got to stop. She can feel it. You said she'd be sedated. You said she wouldn't feel anything. And she felt everything. And they did it wrong. They put the wrong tube down.
So they had to redo it.
They had to start all over again.
And still no more sedation.
They just kept saying, she can't feel it. She can't. It'll be over in a minute. And something that was meant to take 20 minutes took over an hour. And I was screaming the whole way through, please stop it. You've got to stop it. And Mary was saying, I can feel it. I can feel it. Please stop. And they just refused. They just refused to stop it. And just ignored her and said, you can't feel it. She's sedated. She can't feel it. And they had to pull it all out and do it all again. It was absolutely horrendous. And then at the end of it, Mary was taken out, and the nurse said, did you not understand that it was quite a traumatic thing? I said, nobody explained that to us. She said, did you not have a leaflet explain? I said, no, nothing. And we've been so intense on kind of trying to make the hospital visit as safe from an ME perspective. I just felt so stupid after, thinking, why did I not look at this and question it? Great Ormond Street guidance is that it's done under general anaesthetic. Yeah. And when I came out, and I said to the doctor, how could you do that? How could you talk to her like that? And he said, shut up, you stupid woman. I've got to go and save somebody who's bleeding to death. That was what he said. And I was conscious of thinking, I've got to get back to Miriam anyway, because she's just traumatized by this. It was just absolute torture.